Well, I think the first thing to say is over the next 20 years, the number of over 75-year-olds in Scotland is going to double. So we need to be ready for that massive explosion in the number of older people in Scotland. Already, you just need to look at the figures to see how important older people are. Like 70% of the residential care budget in local authorities is spent in over 70-year-olds. If you look at the number of over 65-year-olds, over 50% of over 65-year-olds in Scotland are on 5 or more pills per day. So very clearly there is a huge agenda in there with the ageing of the population and the need for us to cater and be able to have the capacity to cater for the increasing demand that's going to play in health and social care. And of course another major demand for dealing with this is that when older people come into hospital, they need to be dealt with very quickly. Particularly the frailer they are, the quicker they need to be dealt with, so that you very quickly get the situation under control. And again, that requires a degree of resource, a degree of skill that we've never required in the past. But it's very important to do it quickly and do it comprehensively, so that you then increase the chances of recovery for the older person. Testing different ways of doing this is very important. This is a fairly new challenge in terms of the scale of the problem and the number of older people and the complexity. Therefore, we don't know the total solution to this problem. What we need to do is try and test out different solutions in different scenarios in different ways, and then find out what works best, and then adopt best practice throughout the entire system. And this work's being led very ably by Healthcare Improvement Scotland, and they're bringing together in an unprecedented way the data, the information, the experience, the expertise in dealing with all different aspects of treating older people, and I believe is putting Scotland way ahead of the game internationally on how we face up to these challenges in the 21st century.